In the Caribbean, technology is transforming the delivery of healthcare in the Twin Island Republic of Trinidad and Tobago. Disinfecting robots are now being used alongside traditional cleaning methods to enhance infection control and reduce the spread of germs.
It has been revolutionary.
And transitioning from paper to an electronic data system is producing greater efficiency in collecting patient information that is more detailed, thorough, secure, accessible, and patient-friendly.
A life changer for us here at the antenatal clinic.
Every single thing that's been tested from day one, nothing is missing, and everything is always on time.
Trinidad and Tobago's commitment to adopting the Perinatal Information System, SIP and SIP+, along with the integration of health service robots, reflects a forward-thinking approach to public health. These innovations, which complement and support existing healthcare processes and efficiencies, have had a positive impact on the public health sector. Both initiatives are collaborations between the Ministry of Health and PAHO WHO.
The PAHO Trinidad Country Office has been supporting the Ministry of Health for quite some years. And actually, these three projects are aligned to the priorities from the Ministry of Health and the work plan that we have with them in technical cooperation, and also aligned to key initiatives that PAHO is supporting all through the region.
Under the maternal and child health initiatives within Trinidad and Tobago, the SIP and SIP+ pilot projects introduce modern methods for collecting and digitally storing patient information while engaging healthcare professionals in the latest management procedures, with the ultimate objective of further reducing maternal and newborn morbidity and mortality.
So you have the patient's name, their obstetric history, previous pregnancies, previous miscarriages, the type of delivery, the patient's history of smoking, smoke exposure, alcohol or drug use, whether the patient was exposed to any form of violence. We have the past medical history of the patient, the past medical history of the patient's family, surgical history.
You actually get to have continuity of care, and the patient, you don't get a delay in whatever the patient has to have done. When the patient comes back to you, you will actually see from if the patient was sent to hospital, what was done at hospital.
It's way more precise in terms of making diagnosis and early treatment of conditions or complications that might come up with these pregnant women.
Which means a better outcome for mommy and baby, because you're able now to plan, look, this patient has had 5 pregnancies, we need to send her to specialist clinic, or this patient has a history of high blood pressure in pregnancy. At a glance, you see all of that.
One click and you get everything. It's pretty awesome actually, and it helps a lot with our productivity and quality of care that we give here.
A patient who has had her entire antenatal care at one facility, if she shows up at this hospital in labor, we are now able to access that patient's records and obtain relevant information to ensure that she has a safe delivery and safe aftercare. So it is an excellent program. It is free, and it really has helped to decrease our perinatal, maternal and neonatal morbidity and mortality.
It gives me great reassurance, because after having babies, anything could turn left within the first year. So it makes you feel very comfortable that, okay, if something is wrong, I could always refer to that part of it to get the necessary information to fix the problem. So it's a very comfortable feeling.
Another technological innovation that's raising comfort levels at hospitals in Trinidad and Tobago are health service robots. Under a project titled Bringing High and Low Technology, funded by the India United Nations Development Partnership Fund, 8 health service robots were given to the Ministry of Health.
I believe that this project is very unique and actually is one of a kind in the region, having supported Trinidad and Tobago with the procurement of these robots.
6 of the robots are humanoid health service robots, one of which greeted PAHO's Assistant Director, Dr. Rhonda Seeley-Thomas, during her visit to the Arima General Hospital. The other 2 robots focus exclusively on disinfecting critical spaces. One of these disinfecting robots has been winning over human hearts at the Scarborough General Hospital.
It's been a tremendous help, especially towards the health and safety of my staff, because in areas where we have stuff like tuberculosis, it has been able to reduce the risk or mitigate the risk for them when we are actually going to prepare these areas to accept other patients. My staff love it with all the heart. As a matter of fact, she has a name, we call her Roberta. So she's now family.
Initial staff concerns about job losses have given way to a human-robot collaboration as employees recognize their value as a high-performance asset and complementary support that benefits everyone.
When you go into a room with a patient that has TB, even though you clean that room or you sanitize that room has to be aired for at least 12 hours before it's occupied. So you actually have a clinical area that is down. Upon using the robot, that room could be occupied almost immediately, within 5 to 10 minutes of completion of the sanitation process.
The disinfecting robots use ultraviolet light to eliminate bacteria and viruses.
She has a sensor that will sense the room, the size of the room. It will tell us what time it will take to do the treatment. It also does the intensity of the light, right, that would be needed to actually sanitize that area. We are 100% sure that does all the necessary calculations that is needed for any space, whether it be a small space, a large space.
From health service robots to smarter maternal and child health care to digital antenatal records, Trinidad and Tobago is embracing the future of health. With the support of PAHO WHO and partners, we are building a system of smart health that is future ready.
We are setting an example for what medicine in 2025 and beyond can look like and should look like, because the world is digital and we basically have to keep up.
Digital health is for everyone. A healthier, more resilient Trinidad and Tobago.